Hello, my name's Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora clinics based here in the United Kingdom. In this video I'm going to be talking about the different types of brow lift procedure that can be performed. In the previous video I've talked about how you analyse your brow shape, whether you would benefit from a brow lift or possibly upper eyelid reduction. And in this video I'm going to be talking about the nitty-gritty of what's actually involved in a brow lift procedure. So essentially there are two options. One is what we call an endoscopic brow lift and the other is an open brow lift. Now the differences are an endoscopic brow lift is a slightly more modern technique which uses telescopes underneath the skin, and your surgeon will free up the eyebrow and perform the elevation through normally 5 small incisions in your hairline, normally one on either side, one in the centre and one here. They're hidden within your hairline, and as long as you've got enough hair to cover them, you won't really see them. It's a bit of a problem in men who are bald because obviously these incisions will be shown, but in most people with enough hair, you won't lose any hair and the incisions will be really well hidden. The other option is what we call an open brow lift, and that is a slightly more old-fashioned technique where your surgeon will make an incision from ear to ear across the top of your scalp, often waving it, so not a straight line normally, almost a sort of wavy line, because that's hidden better as the hair sort of lies over the incision. But whatever incision's made, your surgeon then goes under the skin and then can free the tissues from your forehead directly by seeing them, and can see the muscles, particularly the frown muscles, and can treat the frown muscles. In an endoscopic technique, your surgeon does the same thing really, but he just does it, he sees what's going on inside via the telescope, and then with special instruments they can divide along here internally. They divide the thick layer of what's called periosteum, which is holding the eyebrows down, and by releasing that the eyebrows will go up, and the surgeon can also treat those frown muscles in that area internally. So both techniques really achieve the same result, and really you just need to talk to your surgeon about the pros and cons of each. Probably nowadays most people would have an endoscopic brow lift because it's much less of a scar, and also the sensation to the scalp is much less affected. With the big cut across the top, the sensation to the scalp behind it can be affected. So really talk to your surgeon about the pros and cons of each. Look at photographs of patients they've treated before. How did the brow look? Look particularly for time. So did the brow stay elevated over 1, 2, 3 years? What are the results with the muscles? Are the muscles weaker? Is the frown changed? Some people actually interestingly have brow lifts and surgery to the muscles to reduce headaches. Some headaches are caused by tension in the frown area, which is known as the glabellar area. So out of 100 people with headaches, if you have either Botox or internal release of those muscles, 60% of people, so 60 out of 100 will notice a benefit and a reduction in the headaches, and of those approximately 40 out of the 100 their headaches will go. So these are all types of headaches. We're not differentiating between migraines, cluster headaches, tension headaches. Just general headaches can be treated by surgery to the muscles here, because this is the tension point that often headaches start from. So in summary, 2 types of brow lift: endoscopic brow lift, open brow lift. Each have got their pros and cons. Some surgeons tend to prefer one technique over another. Really talk to your surgeon and about the pros and cons, why they're choosing one technique over another. Look at photos, ask to speak to patients who've had similar procedures, so you can get a first-hand account of what's involved, the recovery period and the results. So I hope that video has been useful and informative. If you'd like to contact us, you can do so by ringing us, phoning us, or emailing us at Aurora Clinics. We'd love to hear from you and would really appreciate your feedback on the website and videos. So thanks very much for watching the video. I hope you've enjoyed it, and I hope you'll be able to watch more in our series.